Eosinophilia. Eosinophils are type of white cells. When you analyze the TLC, you find that most of it is composed of neutrophils, lymphocytes, maybe monocytes, and eosinophils are generally very low in number. Now, what is the exact normal value of eosinophils varies between different labs. We take that absolute eosinophil count is somewhere between 30 to 350 per microliter. They are slightly elevated if they are more than 500. They are mildly elevated if they are between 500 and 1500. They're moderately increased if they are between 1500 and 5000. Hypereosinophilic syndrome. Now, what happens in hypereosinophilic syndrome? The eosinophils are persistently elevated more than 1500 per microliter along with organ damage. So this is called hypereosinophilic syndrome. When you see eosinophilia, look for the presence of allergic disorder because they are high in allergic disorders like asthma, the allergic rhinitis, atopic dermatitis, eosinophilic esophagitis, or eosinophilic pneumonia. And then there is a condition called DRESS, that is drug reaction with eosinophilia and systemic symptoms. This may be caused by many drugs like antibiotics, for example, penicillins, cephalosporins, tetracyclines, sulfonamides, dapsone, the fluoroquinolones. It may be caused by NSAIDs like aspirin and ibuprofen, drugs like anticonvulsant including phenytoin, lamotrigine, carbamazepine. They can cause eosinophilia, and then certain other drugs like allopurinol, methotrexate, antiretroviral treatment, for example, abacavir, they can cause eosinophilia. So when there is eosinophilia, take the history of drug intake. And then there are miscellaneous conditions, some of which may be quite serious. Parasitic infections, particularly the parasite which infiltrate the tissues like Ascaris and hookworm, they can cause it. And then malignancies, they are important cause because they should never be missed. For example, Hodgkin's lymphoma, acute myeloid leukemia, acute lymphoblastic leukemia, myelodysplastic syndrome, colorectal carcinoma, carcinoma of the lung, the prostate, breast, ovary, cervical cancer, they can all cause eosinophilia. And then autoimmune disorders like inflammatory bowel disease, vasculitis, especially the vasculitis of Church-Strauss type, which is now called eosinophilic granulomatosis with angiitis, and then sarcoidosis, they can cause high eosinophil count, and then adrenal insufficiency is an important reason that patient may have eosinophilia. So this may be one clue towards patient who got adrenocortical insufficiency. So this is what we see when a patient gets eosinophilia on the routine blood count examination.